Hey guys, we are back and we are going to be talking more about back pain, herniated discs, bulging discs. So for those people who have been diagnosed with a herniated disc, which is about 70% of the population, this is going to be for you. So I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're going to go over the top 3 exercises for herniated discs. For all intents and purposes, herniated discs and bulging discs are the same thing. It is not technically the same thing, but usually when you find a script, or when you get a script or you get an MRI, you will wind up with either a herniated or a bulging disc. For the purposes of this video and basically a lot of the treatments, it is the same. So a herniated disc usually means that you're going to have pain going down your leg. One of the caveats that I have to give with herniated discs is I've treated, I can't even count how many people who've been diagnosed with a herniated disc. I can probably count on one hand how many times that was the sole source of back pain. So I get a lot of questions, a lot of emails, a lot of people who come in for evaluations and say it's a herniated disc. And while that's good information to have, it takes a lot more investigation, it takes a lot more hands-on work to figure out all the sources of the pain. It is very, very, very rare that somebody comes in with a diagnosis of a herniated disc that is the only thing that's causing their pain. So while we may do I'm going to show you some exercises tonight that will be beneficial if the pain is truly just coming from the disc, but most times what's going to happen is you're going to need some type of manual work, from a physical therapist in order to help some of those muscle imbalances that you've incurred. So don't just get frustrated and feel like, oh, I'm just going to have a life of chronic back pain if all you do is try and fix a herniated disc by doing disc exercises. It is not usually the case. You're going to have to do these in conjunction with other things, in conjunction with manual therapy, in conjunction with strengthening, to make sure all of that pain goes away. So, and also another thing that I want to talk about in terms of herniated discs or bulging discs is that it's not uncommon for people to come in with a diagnosis of a herniated disc and that have nothing to do with the pain. 70% of all people have a herniated or a bulging disc, and it's just what shows up on an MRI. So we get a lot of diagnosis of herniated disc, a lot of herniated disc and bulging disc. When you come in and we put our hands on you and we do our full evaluation, we actually find that the herniated disc has nothing to do with your pain. But it's the one thing that shows up on x-ray, it's the one thing that, well, it'll show up on MRI, but you'll be able to see it, and a doctor's going to be able to concretely say, oh, there's herniated discs. So just be careful when you get that diagnosis that it is generally not always the only cause of pain, and it is not sometimes to have anything to do with the pain. So a lot of times when people will get an injection or any sort of medication that is to treat a bulging disc or a herniated disc, and they don't see relief from that, it's because it had nothing to do with the fact that there was a herniated disc. It just was something that was showing up on the MRI. A lot of things that we treat for the back, a lot of back pain that we treat has nothing really shows up on x-ray or MRI. So it's very common to have severe back pain. It's very common to have something going on in your back and have all of your scans come up negative. And that's where we do a fantastic job of being able to diagnose the actual problem, because we need to get our hands on you, and that's what we are experts in, is figuring out where those muscle imbalances lie. So when you try these exercises because you have a herniated disc, it may or may not work because of the fact that there may be more going on. So as always, we do offer free consultations. If you do these exercises and you're seeing that there is no result, you want to come in, all you have to do is call our office at 215-997-9898. We'd be happy to see you and give you a free consultation, let you know exactly what's going on. So all that being said, this is for a herniated disc. Now, if at any time you're doing any of these exercises, your pain gets worse, you get shooting pains down your legs, you want to stop, you want to come in. This is not a no pain, no gain type of scenario. So should be no real pain associated with this. When you go and do these exercises, they should feel good. That's all there is. It's not a push through. If you notice any sort of numbness or tingling going down your leg when you're doing them, they are not for you. All right, so the first exercise you want to do is lay on your stomach. Now, some of you may say, I can't even lay on my stomach. So again, there's more going on than just a herniated disc. But let's start with just laying on our stomach. So what you want to do is you're going to start here, all right, and you want to prop yourself up on your elbows. Now, some of you, this may be a challenge, and that's okay, all right? So you can put a pillow underneath here and prop yourself up here and just lay like this, or you can come down. Now, I have a handy-dandy little face hole, which many of you probably don't have at home, or you can just lay like this and tilt your chin up, just so that there's a little bit of curve in that low back, all right? A little bit more extension than normal. So if you see, there's just a little bit more of an extension, a little bit more of a U in my back. All right, so start off gently. Maybe you're here. All right, maybe then you put a pillow underneath and then you're here. And then maybe you work your way up to your elbows. If you truly have a herniated disc and it is causing you pain and the pain is going down your leg, and you find that this actually feels good, you can stay like this, for 5-10 minutes, put a hot pack on your back, and just lay there, just like this, and hold it still, nice and easy. This will help alleviate that pressure on the disc. Again, if this causes numbness and tingling, or you can't get into this position, these are not no pain, no gain exercises, you need to consult someone. So the first one is you're just going to be here, or here, or here. Notice how that back extension is where you lean back. That extension is increasing in my back. The next one you're going to do is a little bit more aggressive than this. So if you can't tolerate this, if it's causing you increased pain, if it's causing numbness and tingling, you're not going to progress to the next step of this. But the next one is going to be coming up onto your hands. And you want to come up all the way onto your hands, and then you want to go back down. Nice and easy, okay? And then push up a little bit further, and then come down. Now obviously the further out your hands are, the less extension you're going to get. And maybe you start out here and that's enough, and then you come down to your elbows, and then you go back up. You want to hold these just for maybe a count of 2 or 3, and then come back down. And then work your way to where your hands are underneath your chest, and then you're pushing all the way up, and then back down. Again, if this is a true herniated disc situation, and a herniated disc is causing your pain, those are going to feel really good. But if you go up onto your hands and you're like, oh, it's pinching, it's not for you. Get off of your stomach, all right? If you can't even get onto your stomach, then you have other issues going on that we need to address. But those two take place on your stomach and can help alleviate some of that pressure. The last one we're going to do is standing up. And it's basically just the same idea of the exercises that we just did, where you put your hands on your back and you're just going to lean backwards. Nice and easy. And again, you want to hold this just a couple seconds and then come back and go up. And you're just going to, again, you're arching your back and you're coming forward. If you start to lean back, or you know you can't lean back because that automatically starts the pain, then you don't want to do that exercise. But this is a good one to do while you're standing at your desk. All right, if you can just stand up and take a break and just do a couple reps of these. There's no real set reps with what I showed you. The more often you're able to do them, the better it is. Obviously, the ones where you're laying flat on your stomach doesn't work real well in the office, which is why I'm showing you this one where you're able just to put your hands on your back and lean back. So that way, even when you're at the office or you're standing in line, you can just quickly do this and kind of be a little bit more inconspicuous than having to lay on your stomach. But again, if any of those exercises increase your pain, increase that numbness and tingling, you want to stop them immediately and consult your healthcare professional. If you are dealing with any back pain and want a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898 and we'd be happy to help you. Thanks and have a good night.